My name is Soto. In this unit, I'm going to be presenting Unit 4, the instructional video for the renal system. The renal process of blood filtration and excretion. Sorry, my throat is, I'm having a lot of coughs. I'm having a hard time talking. Each of the kidney is made of about 1,000,000 filtered units called nephrons. Each nephron includes a filter called the glomerulus and a tubulate. The nephron works through a two-step process. The glomerulus filters your blood, and the tubulate returns the needed substance to your blood and remove all the waste. The use of diuretic and surgical, and the purpose for the intraoperative use of diuretic is they use the mannitol and the formicide. It has been used as a diuretic intraoperative to facilitate early renal allograft function and to reduce delay graft function in a surgical procedure or case. I have this figure which I got it from the surgical procedures, the related content. And 7.2, the mannitol causes a changes in the osmolarity of blood, drawing intestinal and intracellular fluid into the bloodstream. This action eventually increases the amount of fluid excreted by the kidney. You can see here the blood vessels, and then this is where the mannitol is presented or is present. We have here the little spaces right here, intestinal spaces. Right here we have the cells, and then you can see between the spaces right in here where it's spreading and going in is the movement of the fluid out of the cells going into the mannitol where it's present. I have this nice little graph that I found online. It explains the renal corpuscle. We move on. This is this area right here. And then we move on to the proximal convoluted tube right here. We move down to the loop of Helen, where you find the descending limb and the ascending limb. Right down this way, the descending and ascending. And then the distal convoluted tubular. We go down this way. I like it because it differentiates in different colors for people like me that don't know exactly how it works and all of that. I mean, there's videos and everything about this process. I thought this picture explains a little bit more about it. And then we also have the collecting ducts. The collecting ducts comes down from here, down here. And then, of course, you have your medications, thiazide, and the pharmaceutical effect, which is, the green or the medication that the patient takes and then brings all the urine inflammation and any fluid that is retained. It comes out through the ureter, and then patients will pee it. Urinated. How is that different from long-term use of diuretic? So I found this information where it says that you can use it in both short-term and long-term. The short-term is for patients who are having surgery. And the surgical technology should also, understand the purpose for intraoperative, the use of the diuretic and how that difference from long-term diuretic therapy. Intraoperative administration of the diuretic is considered to be short-term therapy and is usually indicated when a condition requires a rapid but temporary reduction in fluid volume. In this case, the anesthesia care provider will administer the diuretic through the IV. The diuretic might be used during surgery to reduce intraocular pressure, to reduce intracranial pressure, or to protect the kidney functions of each patient while in surgery. And then it says, listen, discuss the different types of diuretic agents. I found this information too. Diuretics are drugs that increase the flow of urine. They are commonly used to treat edema, hypertension, and heart failure. Okay, and typically the pharmacology group consists of 5 classes. We have the thiazide diuretic. We have the loop diuretics. We have the potassium sparing diuretics. We also have the osmotic diuretic, and the last one is the carbonatic hydrase inhibitors. That's the group or the different types of diuretic agents available. Okay, now some of those medications are also used, like they say in there, for hypertension for people who have high blood pressure or heart failure or inflammation. So that will help with the inflammation and also decrease the pressure on the heart and the blood vessels when a patient has high blood pressure. And then, yes, the primary function of the renal system is to maintain homeostasis. As you can see, it says that the kidney maintains the homeostasis by filtering the waste from the blood and excreting them from the body through the urine. So anything that you take in through your mouth, it continues going through and is being filtered through the blood, excreting from it, the body, and then final ending in the urine. And then excretion is important because certain waste products, such as the urea, can be harmful in excessive amounts. The kidney also maintain a pH level in the body by removing hydrogen ions from the blood. And that's my PowerPoint. That's my PowerPoint. And this is my reference. Thank you.